Hello and welcome to episode 2 of the WA Preparing for the OSCE video series. My name is Neil Boudville and I am Professor of Medicine in the Division of Internal Medicine at the University of Western Australia. In this video, I'll be talking about the importance of understanding role-playing with the OSCEs, both for the actual summative OSCE, but also in practice formative OSCEs, even the ones you do casually with other students. The aim of this video is to try and make sure you maximize the experience of any formative OSCEs you do and subsequently maximize your score in the summative OSCE. With respect to role-playing, I'm going to divide this discussion into 3 parts. The first part is to do with role-playing as the student being examined. The second part will be role-playing as the actor that you may be participating in during a formative or practice OSCE. And the third part and final part will be about the importance of role-playing on behalf of the examiner that is examining you within the OSCE station. So to start with, let's talk about role-playing as the student being examined, since this is clearly the most important for all of you. Within an OSCE, whether it be an 8-station, 12-station or 16-station OSCE, each station will have a different setting. For example, sometimes you'll be in a rural GP practice, other times in an inpatient hospital ward, and other times in an emergency department, just as some examples. With COVID-19, you may nowadays find yourself doing a telehealth clinic, so you may be in a room with a computer screen and a video camera, or maybe just a telephone. It is important to remember that the 2-minute reading time is not just for reading, but rather it is for you to prepare yourself for the role that you're about to play, which includes understanding your setting. This is all part of what I've renamed as the 2-minute strategy time at the start of the OSCE station, which includes reading the trigger and tasks on the door. The next aspect of role-playing are for those times you are doing a formative OSCE with other students and you are taking on the role of the actor or patient or nurse for that particular station. As the actor for the station, you'll be given some information about the station and the role that you are playing. The nature of the information produced is such that it cannot cover every possible question that a student may ask you. So you really need to try and understand the role that you're playing and provide answers that fit with that role if the answers to the questions are not actually provided for you. It is often not provided because it is not important. Repeatedly, when I've watched students in these positions say things like, "I don't know if I smoke because it doesn't say so." Please don't be one of those students. In addition, and this applies for the students being examined as well as the ones being the actor, when you are doing a practice OSCE, stay in your role for the entire 8 minutes. Don't break it up by having a separate discussion, even if you think you are trying to help the other student. For example, don't try to give advice to the student being examined if they appear stuck. If they are stuck, then they need to develop strategies to get themselves out in case this happens in the actual OSCE. If the student appears to have finished the station but the 8 minutes has not gone, don't be tempted to stop and start discussing the station. Let the student being examined sit in silence until the 8 minutes are up, because you can be sure that that is what's going to happen in the actual exam. The OSCE stations are carefully crafted to make sure that they last 8 minutes. Finally, let's talk about the examiner within the OSCE station. For many OSCE stations, the examiner is a passive observer, in that you can think of them simply as a fly on the wall watching your interaction with the actor. A good OSCE examiner will try to position themselves behind you so that they are not in your field of vision to try and enhance that fly on the wall feeling. You should be able to work this out when you read the trigger and tasks, as it will make no mention of the examiner within the station. If this is the case, then there's no point in turning to the examiner and trying to talk to them, as they will simply turn you away. For example, I was examining an OSCE station where the students were tasked as being a doctor who was to look at an ECG and discuss the findings with the patient and the management of any abnormalities. The temptation for many of the students was to turn to me as the examiner and start describing the ECG changes, but in this situation, it was not appropriate. If we wanted you to do that, then the trigger would have stated this. Please discuss the ECG findings with the examiner, as an example. In some OSCE stations, the examiner may well be themselves role-playing. So in the past, we've had stations where the examiner plays a nurse or a registrar, for example. This will be obvious either by being on the trigger and the tasks, or when you enter the room and, for example, the examiner is the only other person there. If there is any doubt, then they will usually inform you of their role, or you can always ask them. So this concludes episode 2 of the Preparing for the OSCEs. OSCEs have a huge advantage of being a reliable assessment for students due to the standardized nature of them. But with that comes a lack of authenticity and an artificial quality which some students struggle to get their heads around. Hopefully this video will have helped you with that, and you can use this information in all of your practice OSCEs, and hopefully this will translate to a great mark in the summative OSCE for you. Good luck and see you next time.